Americans are going broke just trying to stay alive while the rest of the world gets healthcare for pennies on the dollar. And today we're watching people from both sides figure that out in real time. Welcome back to Mind Mirror. Let's get into it.
For some reason in the US, we have been brainwashed to believe that we have the best healthcare. And that justifies like the high costs that we pay. And then you have people like this that like just don't understand the principles of what health insurance is. Let me unbrainwash you. So let's go to the whiteboard, even though I'm tired. I'm doing numbers from 2023. That is where I could find the most data. Per capita spending per year in the US was around $14,000. In the UK, it was around 3,000 to 5,000 pounds. So we're just gonna say 5K for simplicity. Okay, US dollars, conversion rates. Google them. Life expectancy in the US, 78 years. In the UK, 81 years. Now this is where it gets interesting. Maternal mortality rates out of 100,000 people, 18.6 people died. In the UK, 12.6. Mind you, you have to pay to give birth in the US. The average person pays 20K without insurance and 2 to 3K with insurance, okay?
$14,000 per person per year. Let that number just sit in your brain for a second. The UK is paying a third of that, and their people are living 3 years longer. Their babies are surviving at higher rates. Their mothers are surviving at higher rates. And she hasn't even gotten to the wild part yet, which is you have to pay just to give birth in America. $20,000 without insurance. To do the most natural thing a human body can do, that's not a healthcare system, that's a hostage situation with better lighting.
Oops, I wrote that in red, my bad. Infant mortality out of 100K, 560. And 410 for the UK. You guys. There's one key metric where the US does beat the UK, and that is in cancer deaths. In the US, around 90 people out of 100,000 die of cancer per year. In the UK, it's closer to 100. I'm running out of ink. However, if you look at the amount of people that are getting cancer per year per 100,000, 362. And for the UK, it is 319, okay? So far less people getting cancer per year in the UK. Okay, so more cancer deaths, but infant mortality higher, maternal mortality higher, and it costs you money. You live longer, and this is how much we're spending on our healthcare. An argument that I hear time and time again is, well, I still want to have private insurance because I want to have a choice. Guess what? You can do that here, and it's way cheaper. On average, if you have private health insurance, it's 1,000 to 2,000 pounds per year. That's through your employer. Personally, I don't have that, but I also am lazy and didn't feel like registering through the NHS, which is not hard to do. I just have ADHD. I went just to get a full blood panel. Guess how much it cost me? 200 pounds at a private clinic, and I was in and out in 15 minutes. I had the results in my email the next day. It was better than any experience I've ever had in the US. It was insane.
200 pounds for a full blood panel at a private clinic, in and out 15 minutes. Results in her email the next day. No phone tag, no waiting 2 weeks, no prior authorization. And this wasn't even the free system. This was her being lazy and not signing up for NHS. So the backup option in the UK is still better than the primary option most Americans have. The people screaming about wait times need to hear that real quick. Because I know folks in the States who wait months to see a specialist while paying premium prices. At some point, you got to ask yourself, what exactly are we paying for?
Yeah, you have options to go private if you so desire. It's going to be a better experience than what you experience in the US, and far less money. I'm just trying to unbrainwash you guys. I hope I shattered some of your belief systems today. Goodbye.
I'm a Brit living in America, and people always say to me, you're crazy. Why would you move to America with the healthcare? And quite frankly, we don't have another choice. But today I'm coming to the doctor's office because I'm having an IUD done and I'm so scared. I actually think I'm going to poo myself. I think this is a smart move before. So my OB actually prescribed me oxycodone. Don't know what it is, but she said it's going to help me with pain. Cheers.
Was you scheduled for tomorrow?
Thank you. They've now asked me to do a wee sample, but I just went to the toilet. This is the room. Oh my god, is that where I got sick? Guys, this is actually making me so scared. 2 months ago, I found out I was pregnant. It was an ectopic pregnancy. I had an IUD in that was put in the UK, so I had to have my IUD taken out. And now I'm having it put back in. I'm so scared. I'm scared. I feel like it's kicking in ever so slightly now.
Good.
But I don't understand how... Is it supposed to just make me go?
It's basically heroin.
Okay. Just relaxed, if that makes sense. I actually don't know if I can do it. I feel like now that I'm lying down, it's gone away. I survived. I was screaming so loud.
She just went through one of the most painful medical procedures you can have, and she's documenting it from the table. And honestly, the fact that her doctor prescribed oxycodone for an IUD tells you everything. We don't make the procedure less painful. We just medicate you into not caring. That's the American healthcare philosophy in a nutshell. Don't fix the problem. Just make it so you can't feel it anymore, and charge you double for the privilege.
I went so pale, like I thought I was going to pass out, and the nurses came in, gave me a heated pad for my stomach, a cold one for my neck, and were making me sniff alcohol wipes so I didn't pass out or throw up. And then they made me drink like a sugary apple juice. That was the most painful thing ever, more painful than childbirth. However, what I will say is it was a lot quicker, faster, and just overall a better experience than I had in the UK. Yeah.
Okay, question for Americans, because I see this on TikTok a lot, and I'm really curious. You know, our healthcare system is very different than yours, and we get a lot of stuff for free. Most Canadians are super happy with our healthcare, but I keep seeing in people's comments that Canadians come to the States for healthcare, which isn't really true. In a rare occasion, perhaps, but it's not a regular thing. And I've had conversations with Americans that are like, yeah, but if you were really sick, you would come to the US for healthcare. And I'm like, no, I would not, because I'd have to pay for it.
This question she's asking is the one that keeps the whole machine running. Do Americans genuinely believe other countries have bad healthcare? Or is that just programming? Because think about WHO benefits from you believing Canadian healthcare is terrible. It's not you, it's not your family, it's the people charging you $14,000 a year who need you to think there's no better option, she said. Even if I was really sick, I wouldn't come to America because I'd have to pay. And that one sentence destroys the entire myth that the world is lining up for American medicine. Nobody's flying to the U.S. for healthcare. They're flying out of the U.S. to afford it.
And we get pretty good healthcare up here. So what I'm curious about is, do you actually believe that our healthcare is subpar? Or is that just what you're taught so that you don't want a healthcare system like ours? A lot of developed nations have healthcare like Canada's. It's not so bad.
So today I went to the hospital here in Spain as an American, and I want to talk about my experience because I think it's so important to talk about. I obviously grew up in the US where you pay your health insurance, you go to the hospital, you get your treatment done, you leave, you might pay copay, and then you get the bill at the end. Here in Spain, now I am autonomo here, so I have a visa to live here, so I pay Social Security in Spain. I went to the hospital today, I fell down some stairs, I got stitches, I got an x-ray on my back and my arm to make sure nothing was broken because I had quite a hard fall. And the EMTs came to where I was at the gym where I fell, and then they took me in an ambulance to the hospital. I got my x-rays done, they gave me stitches, numbing, they gave me medication. They sent me on my way home, and all is fine. I'm now resting, obviously. That cost me $0, like out of pocket.
$0, ambulance ride, x-rays, stitches, medication, $0. And before somebody says, well, she pays Social Security taxes. Yeah, that's the point. You pay into a system, and the system actually works when you need it. That's not some radical concept that's just a functioning society. She pays Social Security in Spain and gets full coverage. Americans pay insurance premiums and co-pays and deductibles and co-insurance and still get a surprise bill. We're literally paying more for the privilege of being told no.
Obviously, I do pay into Social Security, so that goes towards my healthcare, but it's so different in comparison to the US because in the US, when I lived there, I paid like $400 a month for insurance, and granted, this was 6 years ago now, but I paid $400 a month for my own insurance, and at one point I broke my foot, and I went to urgent care, and I worked in orthopedics at the time, so I knew exactly what I broke. And I was like, hi, I broke my 4th metatarsal. Can you please x-ray, give me a cast and send me home? And they're like, yeah, of course, no problem. Did the x-ray, doctor came back. He was like, yep, you're right, 4th metatarsal broken. Here's your cast, here's your crutches, sending you home. And it was 45 minutes in total. I got a bill like a couple weeks or whatever later, and my bill was like $16,000. $16,000.
$16,000 for 45 minutes at urgent care. She already knew what was broken because she worked in orthopedics. She walked in, told them exactly what happened. They confirmed it put a cast on and sent her home. And somehow that cost as much as a used car, $400 a month in premiums plus a copay plus still $2,700 out of pocket. At what point do we just admit the insurance isn't actually insuring anything? You're paying for a card in your wallet that gives you the right to pay again when you actually need help. That's not coverage, that's a subscription to getting scammed.
And my insurance covered a good portion of it, but I was still out about $2,700. Mind you, I paid a copay to go to the urgent care. I think it was like $150 or something like that. And I paid $400 a month for my insurance, and then I was still out $2,700. I'm in Spain, and I did the whole 9 yards ambulance ride, EMTs coming to me, pay nothing. So I just don't think America actually cares about your healthcare. Like, I just don't think they care about the health of their people. Otherwise, they would make it so that way it doesn't put people in debt or cause people to go, oh, actually, I'm not sick enough, or don't worry about taking an x-ray because I don't want to pay for it. Like, that's insane. And I just think it needs to change in the US so badly. But I'm so grateful to live in a country where my medical bill is actually just $0 and I got good care.
France has the #1 health care system in the world for the least amount of cost, which is amazing. The US can't even come close to it. I find that healthcare here is about 1/10 the cost of the US, and the care is excellent, so there's no issue with that.
This goes out to everyone outside of Europe that considers moving to Germany because of a better system. Let me just tell you something. This is without judgment, but I know there's a lot of videos being spread around, especially made by Americans, which I'm not judging. Maybe you just don't know it, so I just don't want you to be misinformed. So if you truly know that healthcare is not free in Germany, it's not free at all. You actually have to pay it with your monthly income. It's a different system. You don't get weekly checks. You get not even a check at all. You get like a direct deposit. And from that direct deposit, it's listed that this and that yada, yada, yada amount goes to your health insurance. And that's a couple $100 a month. So it's also mandatory. You cannot be like, I don't want this.
I actually appreciate her for this because she's keeping it honest. Healthcare in Germany isn't free. It comes out of your paycheck, and it's mandatory. But here's the thing, nobody's complaining about it because it works, a couple $100 a month and you're fully covered. No surprises, no denied claims, no bankruptcy. Compare that to America, where people pay the same or more and still set up GoFundMe pages for chemo. The difference isn't the price. The difference is what you actually get for your money. One system treats you like a citizen, the other treats you like a customer they're trying to squeeze dry.
Basically, you cannot decide. It's like you go to work and you say, oh, this is what I'm gonna get, net, and then goes off. So you basically have to pay it and you cannot decide whether or not you want it. It's mandatory. You can do whatever you want with this information, but this is actually true information and you're not being misinformed. And yeah, that's the purpose of this whole video.
Okay, so we just decided a date for the wedding. It's next year on August 15th. No, it's not possible. I have a doctor appointment that day. But it's over a year away and you're my maid of honor. Can't you reschedule? Sorry, but our healthcare wait times are so long. It took me 5 years to get this appointment and I can't wait that long again. Could you just reschedule the wedding? Can I ask you a question about America? What is it like to have a military?
What do you mean? Don't you have one?
No, we don't, because we spend all of our money on healthcare.
Should I call an Uber to the restaurant?
Uber is so expensive. Let's just call an ambulance to the hospital closest to the restaurant, because it's free.
Well, shouldn't those just be for people who really need them?
Well, 90% of my paycheck goes to healthcare taxes, so I say I do need it.
Oh, your baby is so cute. Do you have any other kids?
Yes, I have 11 actually.
Oh, wow. That must be a handful.
Not at all. With universal healthcare, giving birth is free, so it's so easy.
Today we're going to be checking out what do Americans think of socialized medicine, also known as universal healthcare. At least I'm under the impression that socialized medicine and universal healthcare generally means the same thing.
I mean, that's what I always thought, but I don't know if it's true.
But up until a recent video we did, I was under the impression that although I knew universal healthcare systems would work a little bit different in different countries, we learned that not every universal healthcare system is fully ran by the government. Some actually are private in nature, which is mind-blowing to me because I still don't quite grasp how some countries can actually have a universal healthcare system that is at least partially private, because I just assumed universal healthcare would basically have to be government run. But there must be something about how the government actually regulates the private healthcare industry, and then everybody is, taken care of under this umbrella, but it's actually still provided for by insurance companies or something like that. I have no idea how that works. We just learned a little bit about that recently.
Yeah.
But what do you think most Americans in this video are going to say about socialized medicine?
To be honest, I have no idea. Probably, I don't know. I guess it depends on where and who they're asking. I feel like if you go to like a bigger city, people will be like, oh yeah, I think that's great. And then people who like maybe more rural, you might find more people resistant to something like that.
But guys, I just was very curious on what Americans would say about a socialized medicine system in general, because obviously we don't have that here.
Right.
You know, I think we have some good and bad in our system, just like every system does. But the one thing I think most people agree with here in the U.S. is that quality of care is pretty good, but the prices you pay, the prices for insurance and whatnot, it's just insane. And we really need to do something. We need to look at systems outside ourselves to really figure out what a system would look like that would work here. Because I don't think, remember the last video we looked at, I remember them saying that these were health experts, health economists or whatnot, and they said that you couldn't just plug and play one system into the system.
Right, because different.
This dude gets it, and I wish more people had this energy. He's not saying burn it all down. He's saying let's look at what works elsewhere and adapt. You can't copy-paste the UK system into America. Nobody serious is suggesting that. But the fact that he was shocked universal healthcare can involve private companies shows how limited the conversation has been. We've been told it's either total government control or what we have now, and that's a false choice. There's a whole spectrum of options between those two extremes. Every other developed nation found their version, and we're still arguing about whether we should even try.
Different everything,
Yeah,
you know?
different sizes of a population, different cultures, all have different needs.
But it's time for us to look at some way to reduce costs at the very least in this country.
Yeah.
And so, anyways, guys, enough rambling. Let's go and check out, what do Americans think of socialized medicine? New York City.
I guess that makes sense.
What do you think about socialized healthcare?
I do not like the idea of that.
Okay, that is definitely not a New York City accent.
I was going to say, yeah. Well, that's what I meant when you asked, like, what do you think people are going to say? And I said it depends on if they're like in a big city or country. I was thinking they were going to have like people from other places wherever they were.
Tourists.
Yeah.
Well, she's from down in my parts where I'm originally from, right? And she said she does not like the idea of that.
But you also noticed she said socialized instead of universal healthcare.
Yeah.
I don't want the government picking what I can and cannot do.
Well, my husband's from Europe, so I think it's pretty good, actually. I think a lot of people are covered by it. Everybody's covered. They don't have to worry about paying for it.
It's definitely more accessible for everybody. It allows all of us to remain healthy, to live long lives as much as we can.
I think it's kind of a necessity that the government provides healthcare for its citizens.
If everybody has something for free, who's going to pay for it?
Okay, what if people pay for it by taxes? What do you think of that?
Well, that's going to increase. You like to pay taxes?
Well, you are going to pay for it at least during your working life, unless.
That's why I don't like when people say it's free, because it's really not free.
Zero? Here's the bill for your appendix removal. It'll be $13,000. Would you like to pay in cash, check, or set up a payment plan? $13,000? I have insurance. How is this possible? Well, your insurance provider said that it wasn't medically necessary, so they decided they didn't want to cover it. Not medically necessary? If you don't get treated for appendicitis within a couple of days, you die. Well, you can always submit a claim for medical necessity, but in the meantime, I need to know how you're going to pay for this if it doesn't go through. But I don't just have $13,000 laying around. I don't know how I'm going to pay for this. Well, you should probably take the payment plan option then, because if you don't pay it, we'll send debt collectors after you and they can garnish your wages. Take money out of my paycheck? I already spend hundreds a month on health insurance. What is that even good for? Bonjour, I'd like to pay the bill for my appendix surgery. If you didn't have health insurance, it would be a lot of money. It could be almost 600 euros. But good thing you have Sécurité Sociale and a mutuelle, so you don't pay anything. Have a good day. Goodbye.
This is the perfect ending to everything we just watched. America, $13,000 for an appendix removal. Insurance says not medically necessary. France, same surgery, €0 out of pocket, have a nice day. Goodbye, and the wildest part about the American side isn't even the bill, it's the threat. Pay up or we send debt collectors to garnish your wages. You survived a medical emergency. Congratulations, now survive the financial one. Meanwhile, in France, they're wishing you a good day on your way out the door. Same procedure, same human body. Two completely different realities based on nothing but where you were born. Every single person in this video said the same thing in different words. The American healthcare system charges more and delivers less. And the numbers back it up. The question isn't left versus right. It's why are we paying the most in the world and getting mid results? So tell me in the comments, what would it take for you to support changing the system? Or do you think what we have actually works? I genuinely want to know. Like, share, subscribe.